according to the Las Vegas healthcare president, we're about 5,000 nurses short and on the verge of an emergency action. Abel Garcia gives you a look at the front lines through the eyes of a local RN.
This is Brian Panessa. He has been a registered nurse here in the Valley for about 7.5 years. He says right now many nurses like him are experiencing a heavy workload. He says if this continues, the quality of care for patients will decline. It's a daily routine for registered nurse Brian Panessa. Washing his hands, putting on his gloves, masking up, and getting ready to face the challenging front lines in Las Vegas hospitals.
Nursing call-offs, we're short-staffed on floors. We get floated to different floors depending on the nurse ratio either that day or night.
Panessa says it's been a problem for years, not only affecting healthcare in Southern Nevada, but also his own mental health.
How can I help take care of you today? You don't know where you're going, you don't know what your patient load's going to look like, and you're going to be spread thin, and if you're already having a bad day or you're not mentally ready for that shift, that's going to be a rough 12 hours.
Panessa is not alone. President and founder of Las Vegas Healthcare, Diego Trujillo, says thousands of nurses have left their jobs, and the turnover is not keeping up with the growing demand for healthcare.
At the end of the day, when you have an emergency, you want to get the best care, and we need the nursing staff to not be overwhelmed.
Trujillo says right now, Nevada is short about 5,000 nurses, and if the shortage gets worse, he says we could face a state of emergency.
We need a workforce pipeline that will make sense in the state of Nevada.
I reached out to the healthcare union SEIU Local 1107. The union represents healthcare workers in the state. I asked what the biggest concern is right now for hospitals in Southern Nevada. Executive Director Grace Vergara-Mactal sent us a statement which reads in part, quote, "The pandemic exposes systemic issues of staffing shortages. Some workplaces are leaning on high staff-to-patient ratios during the shortage rather than treating employees in a way that entices them to stay." So, Brian, with your experience, if we continue in this direction, what is going to happen to our healthcare here in the Valley?
When that patient to nurse ratio is that high, you're putting your license at risk, but you're also putting people's lives at risk. And that's the scary part about it.
I'm Abel Garcia reporting from Southwest Las Vegas.